CEN Exam Prep Help. Question 1. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A. Administer for pain medication. Option B. Obtain a urine sample. Option C. Notify the provider immediately. Option D. Administer antiemetics. The correct answer is option C. Notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 2. A patient with a urinary tract infection presents with confusion and fever. What is the most likely diagnosis? Option A. Uncomplicated UTI. Option B. Pyelonephritis. Option C. Urosepsis. Option D. Interstitial cystitis. The correct answer is option C. Urosepsis. Confusion and fever in a patient with a UTI, especially in an older adult, suggests urosepsis. This is a life-threatening infection requiring immediate intervention. Uncomplicated UTI, A, does not cause confusion. Pyelonephritis, B, causes flank pain, fever, and chills. Interstitial cystitis, D, causes chronic pelvic pain. Question 3. Which of the following is a priority intervention for a patient with priapism? Option A. Administer pain medication. Option B. Apply ice to the genital area. Option C. Prepare for surgical intervention. Option D. Administer oxygen. The correct answer is option C. Prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A 12-lead ECG has been completed on a patient who presents with chest pain. The ST segment is normal. Which new finding is most critical and requires prompt intervention? Option A. Left bundle branch block. Option B. Right bundle branch block. Option C. Peaked T waves. Option D. Inverted T waves. The correct answer is option A. Left bundle branch block. New-onset left bundle branch block, LBBB, in a patient with chest pain is a critical finding that can mask acute ST-segment elevation myocardial infarction, STEMI, on ECG. The presence of new LBBB with chest pain is considered a STEMI equivalent and warrants immediate reperfusion therapy. Right bundle branch block, B, is less concerning and often benign. Peaked T waves, C, may indicate hyperkalemia but are not as immediately critical as new LBBB in this context. Inverted T waves, D, can indicate ischemia but do not necessitate the same urgent intervention as new LBBB. Question 5. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A. Hypokalemia. Option B. Hyponatremia. Option C. Hyperkalemia. Option D. Hypercalcemia. The correct answer is option A. Hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 6. A patient is bitten by a venomous snake. What is the priority nursing action? Option A. Apply a tourniquet above the bite. Option B. Immobilize the affected limb. Option C. Administer antivenom immediately. Option D. Incise and suction the wound. The correct answer is option B. Immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Question 7. The possibility of an ectopic pregnancy increases when a patient has a history of option A, breast cancer, option B, endometriosis, option C, teenage pregnancy, option D, pelvic inflammatory disease. The correct answer is option D, pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors. Question 8. A patient presents with a temperature of 101.4 degrees Fahrenheit, heart rate of 110 beats/min, and respiratory rate of 26 breaths/min. To consider if the patient may have sepsis, the nurse should assess if the patient has option A, a possible infection, option B, positive blood cultures, option C, an immunocompromised state, option D, been febrile over 24 hours. The correct answer is option A, a possible infection. According to the current definition of sepsis, a patient with signs of infection, fever, tachycardia, tachypnea, should be assessed for a possible source of infection. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Positive blood cultures, B, are not required for diagnosis. Immunocompromised state, C, is a risk factor. Duration of fever, D, is less relevant. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient presents with acute urinary retention. The nurse anticipates the need for option A, Foley catheter insertion, option B, straight catheterization, option C, condom catheter, option D, suprapubic catheter insertion. The correct answer is option A, Foley catheter insertion. For acute urinary retention, insertion of a Foley catheter provides continuous drainage and allows monitoring of urine output. Straight catheterization, B, may be used, but Foley is preferred to prevent repeated catheterizations. Condom catheters, C, are for incontinence, not retention. Suprapubic catheter, D, is used when urethral catheterization is not possible. Question 10. A patient in her second trimester of pregnancy presents with painless vaginal bleeding. What is the priority assessment? Option A, fetal heart tones. Option B, maternal vital signs. Option C, cervical dilation. Option D, contraction pattern. The correct answer is option B, maternal vital signs. Painless vaginal bleeding in the second or third trimester is concerning for placenta previa. Maternal hemodynamic status is the priority. Assessment of fetal heart tones, A, and contraction pattern, D, are important but secondary. Cervical examination, C, is contraindicated until placenta previa is ruled out due to risk of catastrophic hemorrhage. Question 11. A patient who is intubated and mechanically ventilated has a sudden decrease in SpO2 from 95% to 85%. The ventilator alarms are sounding with high peak pressures. What is the first action? Option A, increase VO2. Option B, assess for a disconnection. Option C, manually ventilate with a bag-valve mask. Option D, suction the endotracheal tube. The correct answer is option C, manually ventilate with a bag-valve mask. When an intubated patient experiences a sudden drop in SpO2 with high pressure alarms, the immediate action is to disconnect from the ventilator and manually ventilate with a bag-valve mask, BVM. This allows assessment of breath sounds, compliance, and tube patency. Increasing VO2, A, may help briefly but does not address the underlying issue. Suctioning, D, may be needed later. A disconnection, B, would cause low minus pressure alarms, not high pressure. Question 12. A patient presents with abdominal pain, vomiting, and a blue minus gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue minus gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration. Question 13. A patient is experiencing acute panic attack. Which of the following is the most appropriate nursing intervention? Option A, administer lorazepam immediately. Option B, provide reassurance and remain calm. Option C, place the patient in seclusion. Option D, encourage deep breathing and mindfulness. The correct answer is option B, provide reassurance and remain calm. A calm, reassuring presence is the first minus line intervention for a panic attack. Remaining with the patient and speaking in a calm, quiet voice can help to minus escalate the situation. While lorazepam, A, may be used for severe cases, it is not first minus line. Seclusion, C, may increase anxiety. Deep breathing, D, is helpful but the nurse's calm presence is the initial priority. Question 14. A patient with heart failure presents with acute pulmonary edema. The nurse anticipates which initial medication? Option A, for furosemide. Option B, for morphine sulfate. Option C, for nitroglycerin. Option D, for dobutamine. The correct answer is option C, for nitroglycerin. For acute pulmonary edema, for nitroglycerin is often the first minus line medication as it causes venous and arterial vasodilation, reducing preload and afterload, and quickly relieving symptoms. Furosemide, A, is used for diuresis but takes longer to work. Morphine, B, is used cautiously and is not typically first minus line. Dobutamine, D, is for cardiogenic shock with low cardiac output. Question 15. A patient with suspected stroke has a blood pressure of 190/110 mmHg. What is the appropriate nursing action? Option A, administer 4-labetalol to lower blood pressure. Option B, administer 4-hydralazine. Option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. Option D, administer a nitroprusside drip. The correct answer is option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. In ischemic stroke, elevated blood pressure is often compensatory to maintain cerebral perfusion to penumbral tissue. Current guidelines recommend against lowering blood pressure unless it is extremely high, greater than or equal to 220/120, or the patient is receiving thrombolytics. This patient does not qualify for intervention yet. Options A, B, and D are not recommended unless criteria are met. Question 16. A patient presents with acute pelvic pain, fever, and cervical motion tenderness, chandelier sign. What is the most likely diagnosis? Option A, ectopic pregnancy. Option B, ovarian torsion. Option C, pelvic inflammatory disease. Option D, appendicitis. The correct answer is option C, pelvic inflammatory disease. The classic triad of PID is pelvic pain, fever, and cervical motion tenderness, chandelier sign on bimanual exam. Ectopic pregnancy, A, would present with pain and bleeding but often no fever. Ovarian torsion, B, presents with sudden, severe unilateral pain without cervical tenderness. Appendicitis, D, presents with right lower quadrant pain. Question 17. Which finding in a patient with pneumonia would indicate the need for ICU admission? Option A, respiratory rate of 24 breaths/min. Option B, altered mental status. Option C, temperature of 101.5 degrees Fahrenheit. Option D, WBC count of 15,000. The correct answer is option B, altered mental status. Altered mental status in a patient with pneumonia indicates severe illness, possible sepsis, or hypoxemia, and warrants ICU-level care. A respiratory rate of 24A is mildly elevated and can be managed on a medical floor. Temperature of 101.5 degrees Fahrenheit, C, is common with pneumonia. WBC of 15,000, D, is elevated but not indicative of ICU need by itself. Question 18. Which of the following ECG findings is most consistent with pericarditis? Option A, ST-segment elevation in all leads with reciprocal depression. Option B, diffuse ST-segment elevation with PR-segment depression. Option C, ST-segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST-segment elevation with PR-segment depression. Acute pericarditis classically presents with diffuse, global, ST-segment elevation across most leads along with PR-segment depression. The ST-segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with sudden onset of severe, diffuse abdominal pain that is like a knife. The patient is lying very still. This presentation is most consistent with Option A, acute pancreatitis. Option B, perforated ulcer. Option C, renal colic. Option D, bowel obstruction. The correct answer is option B, perforated ulcer. A perforated ulcer typically presents with sudden, severe, diffuse abdominal pain described as knife-like. Patients lie perfectly still because any movement worsens peritoneal irritation. Acute pancreatitis, A, is often severe pain but more epigastric and often radiates to the back. Renal colic, C, is flank pain. Bowel obstruction, D, is cramping pain with nausea and vomiting. Question 20. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A, hypertension, bradycardia, irregular respirations. Option B, hypotension, tachycardia, tachypnea. Option C, hypertension, tachycardia, Shane-Stokes respirations. Option D, hypotension, bradycardia, hypoventilation. The correct answer is option A, hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion. Question 21. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4-normal saline. Option B, 4-nitroglycerin. Option C, 4-morphine. Option D, 4-oxygen. The correct answer is option B, 4-nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Question 22. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is Option A, tracheal intubation. Option B, 4 fluids. Option C, needle cricothyrotomy. Option D, pleural decompression. The correct answer is option C, needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. 4 fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 23. Which of the following is a classic sign of a hip fracture in an older adult? Option A, internal rotation of the affected leg. Option B, shortening and external rotation of the affected leg. Option C, adduction of the affected leg. Option D, flexion of the affected leg. The correct answer is option B, shortening and external rotation of the affected leg. A hip fracture typically presents with the affected leg shortened and externally rotated. The patient is unable to bear weight. Internal rotation, A, is more common in hip dislocation. Adduction, C, and flexion, D, are less specific findings. Question 24. A patient is brought to the ED after a violent assault. What is the first priority in caring for this patient? Option A, obtain a forensic evidence collection kit. Option B, perform a thorough physical exam. Option C, ensure patient safety and medical stabilization. Option D, contact law enforcement. The correct answer is option C, ensure patient safety and medical stabilization. The ABCs in medical stabilization are the priority for any patient, including victims of violence. Forensic evidence collection, A, physical exam, B, and contacting law enforcement, D, are important but secondary to medical stabilization. Question 25. The nurse is caring for a patient in cardiogenic shock following an ME. Which hemodynamic parameter is expected? Option A, elevated CVP, elevated PCWP, low cardiac output. Option B, low CVP, low PCWP, high cardiac output. Option C, elevated CVP, low PCWP, high cardiac output. Option D, low CVP, elevated PCWP, low cardiac output. The correct answer is option A, elevated CVP, elevated PCWP, low cardiac output. Cardiogenic shock is characterized by pump failure, leading to elevated filling pressures, CVP and PCWP, and reduced cardiac output. Options B and C describe distributive shock, such as sepsis or neurogenic shock. Option D is not consistent with any shock pattern.